Uh, Now I'd like to introduce Mr. Jean-Pierre. He is an expert in TB epidemiological surveillance at the Ministry of Public Health, Hygiene and Prevention in the Democratic Republic of Congo. Before he can start his presentation, please note to all our attendees, he will be presenting today's presentation in French. So we request all our English listeners to please click on the English interpretation channel to listen in, unless, of course, you're also fluent in French. And in that case, please feel free to continue here. Dr. Jean-Pierre, the floor is yours.
Okay, merci beaucoup.
Thank you. Thanks a lot, Katiani. And hello to all the participants here today to this conference for experience sharing today. Regarding DRCs, we will share today this experience that we've had in integrating digital X-ray with AI, which we led in DRC for about 1 year, year and a half, with Stop TB's partnership. Next slide. Next slide. So here we have the outline of our presentation with 5 points that we will look through and try to detail in the next slides. Next slide. As an introduction, I would like to note that DRC is part of one of the 10 countries that has the highest burden of TB cases, and TB, HIV, and MDR TB, with a TB incidence which remains very high, estimated by WHO at 317 per 100,000 inhabitants. We have more than 80 million inhabitants, which means that about every year we have about 14,000 cases of TB. In 2021, we had 246,119 notified cases of TB, with 1,614 cases of MDR TB. So in terms of notified cases, we have about 78% of notified cases. And there's also a gap still present. If we want to reach the objective of reducing TB as a problem, we have to reduce or delete that gap. Therefore, we need some approaches and tools that can help us to reduce this gap. Next slide. To get there, the country was helped by Stop TB with the financing also of USAID to contribute and to help the countries to reach that TB elimination through projects that were put in place, introducing new tools project INTP. And this project was financed by USAID, whose goal was to help the different people who were thought to have TB to have access to a quick and sensitive diagnosis and a detection by using ultra-portable X-ray digital with AI. And those who had positive tests results had to have more tests done. This allowed this population to be taken in consideration quite fast. We all know that X-ray is present for a couple years. Back then, we were not really using it. It was back in the back door and we were not using it. So now we are using it, putting it forth so that we can be more efficient in our results and in the work and in the use of confirmation tests. And regarding the national program against tuberculosis, those radiology services are being put in place, but they are not yet structured properly enough. And the programs are in need of an assistant that can help us to assist and put in place that tool. Next slide. So the country received about 8 different tools, radiology tools, and those tools were placed in 8 health districts on the 519 health districts that the country has. And we chose different sites who were either a hospital in that health district or a health center, a referral health center. And in our early evaluation of those sites, we realized that 4 facilities had already a radiology department, which helped us in that regards. And another criteria of selecting sites, because it was a project that we had started a long time ago, was a good attendance of that structure. For that structure to be easily attended to help us use that element. Next slide. Here's the map of RGC, of DRC, and that project was placed. You can see the different stars in red in the city of Kinshasa. We have city of Mujima, Nikassa Oriental, and Kolwezi, and the city of Lubumbashi also. Those 4 provinces benefited from all those different elements present on the 26 provinces that we have in the country. Next slide. Now, what actions or activities did we put in place? First of all was training. It was a training that was centralized. We identified the 8 interveners who in the 4 provinces that we noted before. And the training happened in Kinshasa for 3 days. And we learned those people how to set up this radiography and how to use it. Not only how to install it, but how to use it. And it was a demonstration that was done for 3 days. And the participants were really satisfied. So that training was put in place by the Delft team, with a radiology technician, with an IT technician, and biomedical technician. Everything was in English, so locally we recruited translators, which helped us to have that French to English interpretation. After that training was done, we installed those different machines. The training was in March 2022, and we installed those elements in those machines in the different provinces. And before that installation, there was an assessment of those trainings they had to receive for those who had to receive those X-ray machines. And that assessment consisted of looking at the premises, because we had to have about 4 square meters to place those machines of digital X-ray, but also to ensure the protection of the population from radiation. we needed to have a source of energy also in those spots. So 7 out of 8 X-ray machines were installed without problem and were operational from July 2022. And one of them did not function properly due to a manufacturing defect that Delft was able to replace a year after to have all 8 working properly. Another activity that was put in place after the training and the installation was maintenance. All the different people present had to have a preventive maintenance training performed by the staff, how to protect the machines, how to ensure that that all the machines were not full of dust, how to have that maintenance that all the people were making in place, and in case of an issue, we had the assistance of Delft team and our local partner here, who's SOR equipment. And this maintenance assistance was done if the technicians were available. So we had to open a ticket, take an appointment to have all the different technicians available to repair the different elements that could break down. Next slide. And those different people trained during the installation of digital X-rays had a support, a great support. The dev team support were able to discuss with them of the different elements put in place, how to use them. We had our assistants, X-ray and TP National X-ray consultant, who helped us to help the people that were trained. We had SOR equipment, which is a local partner who participated to the training, who helped us with all the different maintenance that came after. They really helped us to really understand and use that tools. With Stop TB, of course, we had the quarterly meetings to exchange and to talk and to have different solutions. And then we had a reporting. After that, all those meetings, we had to report data. We know that those data were a presence with the computer that was delivered with all the material. And it was linked to the understanding of our staff and all the elements on the ground. But the different service providers were kind of old. On the new sites, there were newer people, younger people. So it was easier for them to learn about the computer. But for people of a certain age, it was a bit harder to use those tools, the computer, to know how to collect data and to allow for an easier reporting and collecting data afterwards. Next slide. Now, what results did we have in the setting up of those projects? First, we have the 6 first months from 2022, which were the trial months and the learning months. And during those 6 months, about more than 5,300 X-rays were done. And among them, about 1,900 had a score that was superior to 40, which is more probable that those people had tuberculosis. We had 1,300 whose tests had to be confirmed. And among those 1,300, about 377 were TB positive. And then 756 were clinical cases of TB. That was the little challenge that we noticed during that first semester. And from that, we rectified some of our elements and adjusted all the directives and instructions so that in 2023 now, we could better the elements and the different challenges that we were able to face. And in 2023, it was almost 99,575 cases, X-rays that were realized. We had the 3,900 whose score was more up 40 superior to 40. 2,900 whose test had to be confirmed, and of them 1,200 whose test was positive. So we had all those cases that were notified thanks to that tool that was used. So you can see indeed that not all of them used the confirmation test out of the 2,900 people. So they were often sometimes done outside the different structures. And they came to start doing all the X-ray shots. But for the confirmation test, it was either through an expert machine, because we already had more than 40 positive cases and people could not wait. So the results were present and people had to see a clinician. Next slide. So now what are the challenges and the issues that we encountered? We can have about 5, and each challenge we had actions taken to respond. The first one was the surface, the space. The structures, some structures already had X-ray machines, and so the space was reduced, so we needed to find a different room to work in good conditions. Another issue was the training of our service providers. We noticed that we had to train a technician. We trained a technician on every site, at least one technician on every site. But to train one was not enough, indeed, to allow those providers to work correctly. And there was this issue of competency on the use of the tool. So we tried to solve it on the ground by building capacity in the different people who were a certain age. They were able, through this, to do the work properly. Another issue we faced was the problem with the language of the elder. It's not the official, English is not official language here, so the oldest people had some issues with it. To translate some documents in French and to accompany the different service providers. A team was therefore put in place to ensure translation for them. We also worked with a score threshold of 40. It's a score that the country used, because there was a study made before we used all the different equipment. So we had a project of reaching the different scores. But we went kind of wide. We had a number of people who were presumed TB, and this 40 score was used. And we thought after those 18 months of work that there's a need to analyze the data and adjust them. We had some TB clinical cases that were detected. And the last challenges was the cost. The project was free, and then we were able to see what was done to allow a normal functioning. We think that all of this could be integrated in the strategic plan that could use all the different X-ray machines. This way we can see how to finance it. Next slide. Now, what are the lessons that we've learned? First one, it was the link between the X-ray machines and the confirmation test. The fact that we had both of them helped us to better confirm our TB cases. This tool also helped us as a mobile strategy when we did our campaigns in prisons. We were able to bring that tool, even though it's an ultra-portable tool, which means it's easy to carry, but we still had to have a van, so it was not easy to put that tool on our backs. We were still able to carry all of this and to use it in the different prisons. We had a day-to-day support for X-ray consultants. For the adults, there was no problem. For the children, we know that that tool, the score maybe would not be the same. So every time that X-ray shots were taken for children, we had a call for the X-ray consultants to have an interpretation of the score. And for any, of course, difficulties of tools that we found in different structures, sometimes the score was an issue. So we had an issue with a detector charger malfunction. And all of this with Delft Light, we tried to find a solution there. Next slide. Now, as a conclusion, I said, of course, that this tool of digital X-ray helped the program to better its performance. There's 270 cases of TB that we were able to detect by using this X-ray in test with the molecular tests. Those tools were easy to install. After training, there was a real easiness to install them and to operate them without any serious problems until the end of the second year. We had some issues at first, but we were easily accompanied to help to use it. And so the link between the X-ray and the molecular tests were really beneficial. Next slide. Now, what should we do with the results that we had, and what can we see for the next steps? First of all, we said it, the score has to be revised. We have all the data, we're going to analyze them with our consultants and the support of Delft to see how we can revise that score to be 50 or 60, seeing all the data that we've had from the different sites. This would allow us to solve all those issues of clinical detected TB cases. Of course, reduce cases of repair if we have a national spare parts warehouse. That would be the goal, to have that warehouse with all those different materials, chargers, etc. This way it would make it easier for us to deploy them on site. We have to see that with a Delft team. There is a team to be put in place and service providers to have those people to put in place all that system, to help also the team, and how to we have to figure out how to place them in the different areas, the different health districts. We hope, of course, that we will have soon an AI for the different children's X-ray results. we received the machine. We've had more than 250 results that showed that it was positive and that we had a really good result. We want to increase those number of machines available in the health districts progressively. Next slide. That's it. Thank you. Thank you for your attention. It was maybe a bit long, but I think it was necessary to share that experience. Thank you.
Thank you, Dr. Jean-Pierre. It was a very riveting presentation. Thank you for your insights.